Welcome to Shaw Spotlight. COVID-19 is something that is affecting the whole world. We at Shaw Spotlight wanted to give the people living in Thunder Bay in Northwestern Ontario a little more information. I'm here at the Thunder Bay District Health Unit. I'm here with Anita. She is a public health inspector. Anita, let's first of all talk about social distancing. That's not something that you and I are doing right now, just so we can do this interview. But what exactly is social distancing?
Well, it's a fairly new concept that everyone should be following. It is keeping our separation or distance from others to prevent the spread of illnesses, including COVID-19 here in Thunder Bay and actually in the world.
So social distancing is, what is the, I guess you're standing away from people? Are you trying to, how far away should you be?
So in terms of social distancing, we're hoping to keep that 2-meter separation from individuals, which is 6 feet.
Okay, so when you're in the grocery store, when you're out trying to get all the things that you need, you should be thinking about it all the time. Just stay away from people.
Absolutely. So in the grocery store, think of that cart length. It's something that people can visualize in terms of a distance. And when you're in the bank or, as you say, out doing essential work and picking up supplies, making sure that you're keeping that 2 meters.
Now, with social distancing, is it something like, should people be trying to stay at home? Should people be doing their best to not go out?
No, we're telling people that if you do have to go out, and it is essential to keep that 2 meters distancing. So, the things for getting groceries and going to the pharmacy to pick up that medication that you need. So if you necessarily have to go out and travel and do that thing, definitely just keep that 2 meters.
Okay, so that's social distancing. Now, when people are being told that they need to self-isolate, what does that mean?
So to self-isolate means that you're staying home and you're separating yourself from others. This includes people that are at home, and you're limiting your exposure to others to reduce the symptoms and spread of illness.
So I know myself, I live in a house with 3 other people. If you're self-isolating, how do you do that?
It's tough, definitely, but what we're wanting to do is, limit the contact that you have. Try to be creative on ways to communicate with others using electronic devices, Facebook, Skype. So try to be creative and still keep that distancing. And increased environmental cleaning is very key if you are in the home with somebody who is self-isolating and is symptomatic.
I know what I'm saying to everyone in my house right now is wash your hands. I'm using wipes everywhere. I'm cleaning everywhere, and I think that's something that everyone should be doing.
Absolutely. Hand hygiene is number one. We want to make sure that we are washing our hands. We know it is spread through droplets, so ensuring those environmental surfaces that are around us are kept clean. Cough etiquette is super important, so coughing in your sleeve.
Now, I know I have a parent who lives on her own, and and she has compromised lungs. I don't want her going out. What about people how do you help the people like your parents or elderly neighbors and stuff like that? Can you do that if you're self-isolating or if you're social distancing?
Yeah, absolutely. You can help those individuals, but we're suggesting if you are symptomatic and you are self-isolating to limit the contact with those individuals, absolutely.
Okay, so what is the best way for everyone who's healthy? How do you keep you and your family safe?
Absolutely. We want to continue ensuring that individuals go outside. They enjoy the activities that we have outside. So running and going for walks, but ensuring that we are keeping those social distancing in mind. So keeping that 2 meters.
Now, here's the big question. What are the symptoms right now that if people are experiencing that they should be worried about?
If you have a fever over 30 degrees and or a worsening cough.
Now, we all know all this information is changing daily, so we may come back and interview again just to talk about it, but I know another thing we want to talk about is if you suspect that you do or have been in contact with COVID-19, what do you do?
So that's where you should be self-isolating. So if you've traveled outside of Canada, or including the US after March 14th, you should be self-isolating. So, not visiting the healthcare sector, because we want to keep the burden off them to be able to deal with the individuals who are indeed ill. So if you're asymptomatic, so if you don't have any symptoms and you've done traveling, to just self-isolate until you can determine that you aren't symptomatic.
Okay, Now, I know that the hospital is somewhere that they're telling people to avoid if you, at all possible costs. If you have questions or if you think you need to be tested, what's the protocol? What do people do?
So we're hoping that individuals can go on to the Ontario Ministry of Health's website. There is a self-assessment tool that you can do online. It will tell you and direct you on what the next steps are, whether it be self-isolate or to contact a healthcare provider.
Okay, Anita, is there anything else you think we need to tell our community at this point right now?
No, I think the important thing is to remain calm, to really limit social media that's out there. If you're getting information, to go to a very reliable source. Go on to the Thunder Bay District Health Unit's website or the Ministry of Health for updates. It can be very overwhelming on our mental health with all of the message and panic, but just be diligent, practice that social distancing, and take care of each other.
Anita, thank you so much for talking with us today.
Thank you.
Everyone, please stay safe out there. Wash your hands, practice social distancing, and self-isolate if you feel you need to. Keep watching Shaw Spotlight. We'll have more on COVID-19.